Hello YouTube, this is Kez Maina. Welcome back to my YouTube channel. This is a health and lifestyle channel where we talk about different health conditions and lifestyle modifications to accommodate the same. Karibuni. This is October, the month of breast cancer awareness. And today, as I record this, is 13th. 13th is no bra day. And I'm not wearing bra in solidarity. I know you can't tell because my breasts are tiny, but sina bra leo. And also the other reason I do not have a bra is because I want to teach breast self-examination, and that will be best done on a free boob, free breast. That is why I don't have a bra again. So without talking too much about the bra and no bra, but the reason why there is this day is because your boobs need to be let free at some point, and it's not always good to have a bra on 24 hours. I know I am not the only lady who gets home and the first thing you're thinking about is unhooking your bra, and sometimes we even unhook it on the stairs ama mahali tu kwa barabara, wakati mwingine inakuchokeshanga. Even the most comfortable are not that comfortable. Si ati ni kitu raha sana kukaa nayo, lakini tunazihitaji. So no bra day is just a day to encourage that freeness, tuziachilia, na pia sisi tukue comfortable kujiachilia, kuachilia breast zetu bila bra once in a while. They do not have to be tied up kila wakati. That is what 13th October is all about. So yes, we are done with the no bra day. By the way, I'm done talking about bras and no bras. The rest of this conversation will be about breasts, boobs. The rest of this conversation will be about boobs, and yeah, I am going to start with signs and symptoms of breast cancer. After the signs and symptoms, we are going to do breast self-examination. So let's go into it. So the signs and symptoms of breast cancer include breast pain. Uchungu mahali popote in your breast should raise alarm. Don't just ignore it. Afadhali uende iangaliwe, you're told it's normal. Another thing to watch out for is any abnormal appearance of your breast. So you need to be observant. You need to look at your breast every so often. Well, I'm saying it like people don't look at themselves, but I mean, not ile ya haraka ukitokanga shower ukiendanga. That is why this video is talking about signs and symptoms and breast self-examination, because I think through breast self-examination is when you will notice a sign ama pia symptom. Hapo ndio utajua. When you're examining yourself, you may not notice anything by looking at yourself like this, but when examining yourself, you will notice something, and you will go to your doctor if you need to. So that's why we are combining these two. So you need to check for any skin color change on your breast, any part of your breast. That is another symptom. The other symptom is that you need to look at your nipples. Look for any changes in your nipples. Check for dimpling. What we call dimpling is the nipple going in, not being in. Okay, there is the inverted. Inverted is zikikuwa ndani, and there are people who just naturally have inverted breast. But when you stimulate it, it should be erect. It should inafaa iamke. But if you notice that your boobs are ziko ndani and they're inverted, let me use that term, they're inverted, and when you stimulate it, the nipple is not coming up, you may need to see a doctor. Also, on that same point of the nipple, you also need to see if there is a side of it that is more dimpled, more sucked into the breast than the rest of the part, and does it look similar to the other breast. Most of the time, breast cancer attacks one breast, then goes to the other. So there is usually a likelihood of you noticing there is a difference from one breast to the next. Okay, so we've talked about the nipple, and we are still at the nipple. You're also supposed to look out for discharge, any discharge coming out from your nipples. It could be blood stained, it could be pus, it could be clear fluid like water, maybe somehow sticky. You need to watch out for all of those and report if you find something unusual. Another sign or symptom. It's a sign and a symptom at the same time. It's redness and itching of the breast skin, nipple pain as well. You also need to check on the change in the skin and the breast size. Kama there is swelling, you need to watch out for that. If there is no swelling, you also need to check out for that. Mainly the symptoms ni hizo, and also feel for any lump, any mass inside your breast. Yeah, so with the signs and symptoms we are done, and next we're going to talk about risk factors. I'm going to mention but a few. There are quite a number of risk factors. As we all know, cancer doesn't have a specific cause, but it has things that may put you at a higher risk. Because what cancer is multiplication, abnormal multiplication of cancer cells of whichever organs that is affected. In this case, we're talking about the breast. That abnormal multiplication of the abnormal cells. That is what cancer is. It is not necessarily caused by anything. And the risk factors I'm going to talk about today doesn't mean they cause cancer, but they increase your they predispose you, they increase your risk of getting the cancer. I hope we are together up to that point. So risk factors, there are some you can change, you can do something about, some you cannot. So let me first talk about the things you cannot do anything about, things you cannot change. Things like the genetic makeup of someone. If your genetic makeup is inclined to getting breast cancer, you do not have anything to do about it, but you're still exposed. There is family history. Mostly this is the first family, either your sister or your mom, your brother. If someone in your circle, yeah, I said your brother because males can also get breast cancer. If someone in your family, in your, let me say, nuclear family has breast cancer, you have a higher chance of getting breast cancer. And there's also a higher chance of you getting breast cancer even if anyone from your family in the back had a history of breast cancer. Kama alikufa na breast cancer 10 years ago, you may be at risk. It doesn't necessarily mean that it will get to you, but you are at risk as well. Another thing is early menarche. Early menarche means you started your puberty early, and late menopause means you got to your menopause a bit late. So this means that you have a long window of hormones zikicheza kwa mwili. That's the hormones now. The excessive hormones do play a role. The hormone estrogen, not the excessive hormones. Okay, it's excessive somehow, but yeah. Your hormone estrogen has a role to play in breast cancer. Okay. We continue with the risk factors. Advance in age. The older you get, the higher you are at the risk of getting breast cancer. Gender, being female, puts you at a higher risk than being male. What else? Past history of breast cancer. I mentioned this in my previous video. Breast cancer can recur. So a past history of breast cancer is a risk factor for you to get breast cancer. And also history of treatment with radiations in the past. Good. Those are things you cannot change. Now I get into things that you can change. Things you can change, number one is being overweight. Being overweight, how you can change that is maybe lose weight. Physical activity somehow helps. Even if you will not lose weight, it still reduces the risk for you. Not just for cancer, but for a lot of other issues, a lot of other illnesses we are going to be talking about on this channel. Alcohol intake, too much alcohol intake. So to counter that, you moderate. Reproductive history. If you have a history of recurrent miscarriages. That is something that may predispose you. So if pregnancy doesn't get to term one too many times, because of this hormonal surges, you're predisposed to breast cancer more than someone who takes their pregnancy all the way to term. What else? Intake of hormones, hormone repress therapy, and zile family planning pills tunamezanga. We talked about it in a previous video. Go back and watch. Yeah, we mentioned this being one of the side effects, that too long use of COCs may predispose you to what? To breast cancer and ovarian cancer and whatever else we said. But today we are talking about breast cancer. So if you missed that, I'll leave a link below so that you can, once you're done watching this, you can watch the other one. I think we are done with the risk factors, and now I will get into the breast examination. And for the breast examination, you will allow me to remove this. It's kind of sexy. So for breast self-examination, we are going to talk about how the first thing you do is look at yourself, looking at your mirror. Mi niko na kioo mbele yangu hapa. So what I'm doing, so my eyes will not be on the camera, mainly they will be here. What I'll be doing first, I will check, are my breasts aligned? That is one thing I'll check. How are my nipples looking? How is the skin around me looking? It is better to look at yourself down, direct to your mirror, than looking down, because when you're looking down, you may not be able to exactly tell the difference, or even tell if you can see anything abnormal, you know. But when you're looking right ahead, you can tell one of them is swollen, the other one is not swollen. One is a bit bulkier and feels, you know. Yeah, so the number one thing is to look at any skin changes, any swellings, any discharge. There are sometimes you do not even have to press on the nipple. You may be experiencing discharge without having to press on the nipple. But sometimes when you're examining yourself, and oh, I did not mention, you're supposed to do a breast self-examination once a month. For ladies who are receiving your periods, you do it on the 7th day of your 7th day of your cycle. That means from the first day of your period, you count 7 days, and that is when you do it. The reason you're doing it at this time is because your breasts are the least sensitive at that point. Hormones zimetulia, ulishamaliza kunyesha, hauja ovulate, mambo ni mzuri. Yeah, you all know if you're on your period or if you're ovulating, your breasts tend to be sore. Hata mtu akupitia hivi tu kidogo, not funny. So yeah, examine yourself on the 7th day of your cycle. For people maybe who've gotten to menopause, so you no longer receive your periods, or if your periods are irregular. But if your periods are irregular, see a doctor and find out why your periods are irregular. But meanwhile, since you still need to do your breast self-examination, you select a date that you are sure you cannot forget. Maybe your birthday, maybe the birthday of your daughter. Yeah, something that you will recall. That way it is easier for you to recall to do it every month.